Hello everyone. If you're here for the HIPAA compliance webinar, you are in fact in the right place. We've got a poll open for you now. We're just waiting for people to kind of file into the virtual meeting room here. We had a lot of sign-ups, so it should be a packed session, and we'll just get started in just a few minutes. Okay, I said a few minutes, but I meant a few seconds. You are here in the webinar and you're in the right place. Thank you very much for coming. My name is Scott Colonico. I'm the editor of MSP Business Management. Today's webinar is HIPAA compliance, what you need to know to grow and profit. With me today as my guest is Mr. Art Gross from HIPAA Compliance Now. How you doing, Art?
I'm doing well, Scott. Thanks. It's HIPAA Secure Now.
Oh, HIPAA Secure Now. I'm sorry. Yes, I've kind of built myself an impromptu recording booth over here. I'm in a building that's about 300 years old, so it's a bit echoey. So I can only see part of the screen. What I'm going to do now is share this poll with you. Thank you for voting, everyone. I'll close that and share that. Is your business affected by HIPAA? Poll results: 72% people said yes, 4% said no, 16% said not sure. 7% said they were afraid of hippos. So, Art, hopefully that will give you something to talk about there.
Yeah, definitely. Maybe not the hippos, but we'll definitely we'll talk about how it affects their business.
Okay, excellent. So I'll go ahead and let me close that poll for you now, and then we'll do some a few housekeeping chores here. Hold on just one second. There we go. Okay. Okay, Art, I'll go ahead and make you the presenter. For everyone, before we start, everyone, we are recording today's webinar. It will be available. You get a link from the GoToMeeting software where you can download the webinar and listen to the podcast. We also put it on podcast on our MSP Business Management iTunes channel. Hold on just one second. I just had one thing. You're getting control over there, Art? Yeah, hold on just one second.
Yeah, here we go. Okay, can you see my screen?
Not yet. Hold on, that's something on my side here. Okay, Art, why don't you go ahead and tell us, let me fix this. This is a technical issue on my end. Why don't you go ahead and tell us a little bit about your business before we get started here?
Sure. My name is Art Gross. I'm the president and CEO of HIPAA Secure Now. And what we do is we help businesses, whether they're medical practices, dentists, doctors, or business associates, IT, billing companies, lawyers, with HIPAA compliance. And I'm going to go through exactly what is HIPAA compliance, so you understand exactly what HIPAA compliance is and how we help organizations with HIPAA compliance. How's that, Scott?
Sounds good. Can you share your screen there? You're hitting.
Yep.
So I've got you.
Yep.
Yeah.
Can you see it?
Yep. There we go. Okay, we're all good.
Excellent. So as I said, my name is Art Gross. I'm going to talk about HIPAA security, what you need to know to comply with HIPAA, and maybe even more importantly, how you can profit from HIPAA security.
Okay, excellent. Thanks, Art. Just a couple of housekeeping things I was going to throw in there. Like I said, we are recording this. Please feel free to ask questions of Art during the webinar. I'm going to get them all, and we'll collect them at the end, and we'll have about 5 or 10 minutes at the end of the session as a Q&A. So go ahead and just type your question into the GoToMeeting interface there. And I'll go ahead and be quiet now, Art. So you ready to take it away?
All right. Sounds good, Scott. Thank you.
Okay.
So what we're going to do today is, we're going to talk about HIPAA. We're going to look at the current healthcare IT landscape and how big the market is for healthcare IT and the growth. We'll then get into what is the HIPAA security rule, what are the requirements, talk about the new HIPAA Omnibus rule that just went into effect and how that directly affects you and what the changes are. And then we'll talk about leveraging HIPAA security to grow your MSP business. We'll then dive into how expensive breaches are and why you want to protect patient information, look at some of the 2012 top breaches so you can understand it, and then go into things that you and your clients, your customers can do to protect patient information. And then briefly, I'll just talk about HIPAA Secure Now at the end of the presentation, and then we'll open it up to some questions. Okay, so the healthcare IT landscape, basically what's happening is the government is incentivizing medical practices, dentists, doctors, hospitals to move away from paper-based records to electronic health records. And they have a program called Meaningful Use, and it's Meaningful Use incentives. The government's given $20 billion to these organizations to implement electronic healthcare records. And what we're seeing is there's a big push now, big push to put in EHRs, to put in the technology to move away from paper to electronic patient records. Unfortunately, with that, what we've seen is there's been at least 22 million patient records breached since 2009. And in response, Health and Human Services, the government, is increasing HIPAA enforcement. They're trying to protect patient information, and they vowed to increase it even more to make sure that all this electronic data is protected. And just one further note, that Meaningful Use gives $44,000 per physician. So if you have a medical practice with 5 physicians, it's going to give you $250,000 right there. If you have it with 10, it's going to give you $500,000. So a lot of money is being given to medical practices and covered entities, that's what it's called, to implement electronic health records. And as an article just came out recently, basically Health and Human Services, Leon Rodriguez is the head of the Office of Civil Rights, basically has committed to saying HIPAA audits more to come in 2014. The Health and Human Services is putting in a permanent audit program. So they are going to start auditing not only covered entities, but business associates, all of the contractors of these covered entities. So we're going to see a lot more audits in 2014. So let's take a look at the healthcare IT market, or HIT market. It's a very big market. It's been estimated at $40 billion in 2012 and growing to $56 billion in 2017, about 7% annual growth. It's one of the fastest growing markets in the economy. So, as an MSP, this is a market that you definitely don't want to ignore, and you want to get in, or you want to expand your presence. And with Meaningful Use and all of that money that the organizations are getting, they're going to spend a lot on IT services. All right, so let's look at what HIPAA is. All right, so HIPAA, there's actually 2 rules with HIPAA. One is the privacy rule. That affects all paper-based records, meaning you have to protect paper-based and information. You can't disclose information to people that are not authorized. Then there's the HIPAA security rule, and that's all about electronic patient information. It's actually called Protected Health Information, PHI, electronic PHI. And what the HIPAA security rule says is you need to protect the confidentiality, the integrity, and the availability of that data. Like, think of it as the CIA, all right? When we look at the confidentiality, you want to prevent, again, unauthorized access, make sure only the right people see that information, protect against outside hackers, and protect against employees accessing information that they shouldn't be accessing. And you want to protect against the integrity. You want to make sure that people can't change or destroy information that's not authorized, and you don't want to be able to delete records in your EMR. You want to protect that patient information. And then you also want to make sure that you protect the availability of PHI, meaning you have to be able to get to patient information. So you have to be able to respond if your EMR, your EHR crashes. A lot of that has to do with data backup and disaster recovery. So as a whole, the HIPAA security rule is all about protecting the confidentiality, the integrity, and the availability of patient information. Okay, so what are some of the things that you have to do to comply with the HIPAA security rule? Well, the main piece and the main foundation of the HIPAA security rule is all about a HIPAA risk assessment. And a HIPAA risk assessment basically looks at where patient data is, how it's currently being protected, what are some of the threats to that patient information, and what can an organization do to lower the risk. So the steps of a HIPAA risk assessment is the first one is to identify and document all electronic protected health information repositories. Where is patient information? Identify and document the potential threats and vulnerabilities to each of those repositories. Assess the current security measures. How is it being protected? And then you determine the likeliness of the threat. And then if that threat does occur, what's the impact of that threat? And that allows you to then determine the overall risk of each threat. So you can think of it as a fire or a flood. What happens to that data if that threat occurs? What if somebody loses a laptop if it has patient information on it? What is the impact? And then out of the risk assessment is basically recommendations to lower, that of additional security that can lower the risk of that threat. And then you need to document the findings of the risk assessment. So that's a standard methodology for doing a risk assessment, and I'll get into that a little more in the next couple slides. In addition, to comply with HIPAA security rule, you need to develop policies and procedures, written policies and procedures. They can be electronic, but they can't just be word of mouth. They actually have to be documented that address the administrative, physical, and technical safeguards of the HIPAA security rule. So some of the things you look at is documented termination policy, documented disaster recovery. Physical is about making sure servers are in locked cabinets and laptops are not easily stolen. And technical is you look at encryption, you look at access control, those kind of safeguards. So basically 18 administrative, physical, and technical safeguards that need to be documented. In addition, the organization needs to train their employees. They need to tell their employees about HIPAA security, why they should be concerned, how they should protect patient information, and then provide them with ongoing training, periodic reminders, and ongoing training to make sure that they are protecting patient information. An organization has to have an incident response plan as well, meaning if there is a breach, if an employee does lose a laptop, how is that organization going to respond, and how are you going to deal with that breach? And then you need to maintain business associate agreements. So all of these covered entities, hospitals, doctors, dentists, any of their business associates, which could be IT companies, lawyers, billing companies, accountants, they need to have contracts with those organizations that say that organization will protect patient information just like the covered entity would. Okay, so now, I talked about the risk assessment, and if you're an MSP, you'll be very interested to see that some of the results that we've found. We've been doing risk assessments now for 4 years, HIPAA risk assessments, and these are some of the common findings that we see. So when we do a risk assessment, we see that the organization may not have encrypted off-site backup. A lack of implemented and tested disaster recovery plan. Not only do you have to have a disaster recovery plan, but it's got to be documented. It's also got to be periodically tested. Lack of email encryption. So we're seeing patient information being sent via email without encryption. Lack of laptop encryption. A lot of patient information on laptops and also mobile devices, tablets, and smartphones without any encryption. So if those devices are lost or stolen, you have a big breach. Lack of antivirus on all endpoints and servers, lack of security patching on servers, lack of servers and desktops, lack of security penetration and vulnerability testing, and a lack of security incident response procedures. So, clearly these are lack of IT security that put patient data in harm, and that's what the risk assessment basically identifies and suggests that these safeguards be implemented to lower the risk to that data. Okay, so now let's talk about the third rule under HIPAA, which is the HIPAA Omnibus rule. And it was effective March 26th of this year, and it's just being enforced in September 23rd of 2013. So it is in effect right now, and basically all organizations need to be complying with this. So the first change that the Omnibus rule has brought to HIPAA is all about business associates, and that's probably each one of you sitting out there, or at least the ones that said that it affects your business, or maybe you're not sure. Okay, if you have medical healthcare clients, either hospitals, dentists, doctors, chiropractors, and you're providing services, there's a good chance that you're a business associate. All right, so the first change is that all business associate agreements between covered entities and business associates need to be revised with the new wording. We always like to caution business associates to be very careful. Some of these agreements are very straightforward and say that your organization will protect patient information just like our organization. Other business associate agreements are drafted by lawyers, 15 pages long, will hold you financially responsible and could be very harmful to your organization if there is a breach. So a lot of times we recommend to business associates to provide their customers with a business associate agreement before that customer makes you sign their business associate agreement. And make sure you read those business associate agreements very carefully so you understand how, what financial penalties that you'll have if you have a breach, how quick you need to report the breach to your customer, and whether you need to report that to their patients or their clients as well. So business associate agreements have to be revised, and you should really take a careful eye on any business associate agreement that you see. The second big rule, big change, is business associates now are directly regulated by HIPAA. That means in the past, all that needed to happen was a covered entity needed to have a contract with their business associates. And there was really no other enforcement to the business associate except for that contract. Now, if you're a business associate, you not only have to have a contract, but you're directly liable for HIPAA compliance. That means you need to do a risk assessment on how you're protecting patient information. You need to have policies and procedures on how you're going to protect patient information. You need to train your employees. You need to have an incident response plan. And now you need to have business associate agreements with your downstream contractor. So any contractor that you use, that you disclose information to, so a good example would be you have a client that's a physician's office. You're providing backup services, and you're utilizing GFI and storing that data on GFI's servers. You would have a business associate agreement with your client, and then you would need a business associate agreement with GFI. So you were disclosing information. GFI is a downstream contractor to you. You would now need business associate agreements with any of those downstream contractors. Same thing if you're using Datto or Apashore or any other type of services where you're storing patient information. Even if it's encrypted, even if it's protected, if it's stored on another organization's servers, they are a business associate and they need to sign business associate agreements, which leads us right into the third big change. Cloud providers are now business associates, even if the data is encrypted. So if there's patient information in email and the organization's using AOL or Yahoo, they need to have a business associate agreement. If they're using Dropbox to store patient information, that organization needs to have a business associate agreement in place. Unfortunately, AOL, Yahoo, Dropbox, none of them will sign business associate agreements. So using AOL, Yahoo, or Dropbox is not HIPAA compliant. Microsoft was the first organization, big, large cloud provider with their Office 365 platform that will sign a business associate agreement. And Google has now committed to signing a business associate agreement, but only for the paid Google apps. So if you're using free Gmail and you have patient information in there, that they won't sign a business associate agreement, and therefore using that platform is not HIPAA compliant. Okay, another big change that the HIPAA Omnibus rule brings to HIPAA is the new data breach rule. Basically, there's going to be a lot more breaches and a lot more notifications to patients. And I like to say, now you're guilty until proven innocent. In the past, if an organization had a breach, they got to determine, is there harm? Was that information harmful to that patient? That's no longer the case. That harm threshold has been taken out, and now is there a high likelihood that that patient information has been disclosed? All right, so you now, if you lose a laptop or your customers lose a laptop and has patient information, they have to prove that that information was not disclosed. Well, one, if you can't get the laptop back, you have to assume that it was. Two, if you do get the laptop back, you have to prove forensically that that information was not accessed. So we're going to start to see a lot more patient notifications and a lot more breaches, right? And then the last big change is that penalties are now up to $1.5 million. So if you have a breach, that organization could have a fine up to $1.5 million. So a lot of changes that affect covered entities, but a lot that affect business associates under the HIPAA Omnibus rule. Okay, so with all that said, and now that you know a little more about HIPAA and what are some of the requirements, is the good news, and that was some of the bad news about the business associate, but the good news is that you could use HIPAA security to grow your MSP business, all right? So, you can use it to expand or enter the health IT market and capitalize on that growth. We tell some of our partners that they could bundle HIPAA security into their MSP offering, help their clients with HIPAA security and potentially sell additional IT services, which I'll get into. If you start to focus on HIPAA and you start to target that to covered entities in the healthcare market, you can differentiate yourself from other MSPs. And there's a very big market for these services. Basically, there's in an estimate, there's a million organizations, hospitals, physicians, dentists, chiropractors. That's the official estimate. I think that number is actually probably very low. It may be twice as large of a market. But in addition, there's also a very big market now for business associates, medical billing, accountants, lawyers, staffing, EMR companies, and that is another 1 to 2 million organizations. So you're looking at anywhere between 2 and 4 million organizations that need to comply with HIPAA. And as you can see, it's anywhere between a $2 and $4 billion market for HIPAA security services. So, as an MSP, it's one that you don't want to ignore, and you want to be involved in that market to help grow your business. And the nice thing is, if you can get a customer or client to perform a HIPAA risk assessment, it's a good chance that risk assessment will justify the need for additional security measures. An MSP, as an MSP, you can sell those security services, sell encryption, disaster recovery, offsite backup, and also become a trusted advisor on HIPAA security. So the risk assessment, I like to say, is your best friend as an MSP, because it's not you telling the client that they need to implement disaster recovery. It's HIPAA and complying with HIPAA regulations that's telling them that they need to implement these additional security measures. Okay, so now let's take a look at the cost of HIPAA breaches, because some of this is good for you to know, but it's also good for you to be able to explain to your customers. In 2011, Ponyman Cost of Data Breach Study estimated a health care-related breach, not retail, and then they looked at all of the type of breaches. Healthcare-related is an estimate of $240 per record. So if you have 1,000 records breached, you're looking at $250,000 worth of breach-related expenses. This doesn't include any fines that the government would give you. These are just cost of dealing with a breach. And what makes up that $240 per record? It's basically all about damage to reputation. All right. With the study found that if you have a breach of patient information, there's a good chance that you're going to have a turnover of existing patients or customers. And less patients or customers are going to go to that organization because of that breach. So let's take a look at one example. Phoenix Cardiac Surgery, a small cardiac surgery center in Phoenix. They have 3 doctors and about 15 employees. And it turns out that they were posting patient information on Google Calendar. And if you logged in, you could see other patients' information. So Health and Human Services audited them and found and asked them, okay, you had this breach. Show us your risk assessment. Show us your policies and procedures. Show us that you've trained your employees. Show us that you have an incident response plan, that you have business associate agreements, et cetera. They didn't have any of that. Basically, they had nothing. They have not taken HIPAA seriously, and they received a $100,000 fine, okay, for basically ignoring HIPAA and not complying. that fine's bad enough. I mean, that's not an insignificant fine. But in addition, now, if you do a Google search on Phoenix cardiac surgery, the first record that comes back is their normal website. The next records are all about this $100,000 fine, and the next 8 pages in Google search is all about this $100,000 fine. Okay, and so if you're a patient looking for a cardiac surgeon in Phoenix and you see this, you may not know anything about this HIPAA fine, but you may decide, you know what, maybe we should just avoid this and go to another care provider instead of using Phoenix cardiac surgery. So a lot of business is going to be lost because of this breach. In addition, if an organization has a breach that affects over 500 patients or individuals, it needs to be reported to Health and Human Services, and they have a website which I have up on my screen. I like to call it the Wall of Shame. So if you have a breach, then you have to tell Health and Human Services. They post it. Another spot that patients or customers could find that organization and maybe avoid using it. So there's definitely a damage to reputation because of breaches. And so those are the indirect costs. The other direct costs that make up that $240 per record is detection and escalation costs, basically forensics of finding out what happened in the breach, notification costs, contacts, contacting patients and customers, and then also post-data breach costs, help desk activities, fielding calls from concerned individuals, and then providing identity protection services. So as you can see, it's very expensive to deal with a breach. It's a lot cheaper to protect information and not have a breach. Okay, so with that, in the next few slides that I'm going to go through, really we've given this presentation to clients, but it gives you some good talking points and some good understanding of some of the things that organizations need to worry about in terms of HIPAA and protecting patient information. In 2012, the largest breaches in the categories were 40% of all of the largest breaches were due to lost laptops and portable media. The second largest was inappropriate access, and I'll go into what that is. The third is insecure email with patient information. The fourth largest breach was hacking and stealing of information. And the fifth is lost backup tapes and all of the data that was on those backup tapes. So the first and largest category of breaches, it was lost laptops and portable media. And we were talking about laptops, smartphones, USB drives, CDs, etc. And when we do risk assessments, a lot of our clients always say, "Oh, we don't have any patient information on our laptops or our smartphones. We don't do that." Now, as we dig in a little bit, and we start asking questions, do you ever send patient information, not to patients, but internally? Do you mail, patient information between employees? Oh yeah, we do that all the time. Now, when we explain that gets replicated down to smartphones or it's sitting in Outlook on a laptop, they look at us and say, "Oh, I didn't realize that's where patient information was." So one of the things that is really important is the use of encryption. Under the HIPAA security rule, encryption is a safe harbor or get out of jail free card. Basically, if a device is encrypted and that encryption password is not with that device, it's a safe harbor, meaning you do not have to report that as a breach. All right, so you can take a laptop with 1,000 patient records. If it's encrypted and the encryption password is not with it, you can hand it to a stranger on the street and you could act as though there was no breach. So encryption, it basically allows you to avoid any breach notifications, allows you to avoid all of those costs associated with breaches. Encryption now is inexpensive and it's very easy to implement. So anywhere where organizations can encrypt, not only laptops, desktops, servers, smartphones, tablets, email, you want to look, and part of the risk assessment identifies where organizations should utilize encryption. The second largest category of breaches is inappropriate access to patient information. All right, so what is inappropriate access? It could be snooping. All right, it could be looking at patient information when an employee has no reason to be looking at that. when Kim Kardashian had her baby, it turns out that six employees were snooping at her records, and they were fired. They were caught doing that, and they were fired because they had no reason to be looking at that and violating her privacy. In addition, what we have is another thing that's going on in Florida is gang members who are normally on the streets, selling drugs. They are getting their girlfriends hired at medical practices, and the girlfriends are stealing patient information, either emailing it to themselves or copying it to USB drives. They're giving it back to the gang members who are filing false tax returns with that information. These gang members are making $50,000 a night, so it's a big business. And it really shows that the value of patient information. In fact, on the black market, a credit card is worth about 99 cents. A patient record is worth $50, right? It's very valuable, and you can tell just from some of the examples, it needs to be protected, and there's a lot of people, both inside and outside organizations, that potentially could steal this information and use it in ways that they shouldn't be using it. And then you also have to worry about disgruntled employees, terminated employees, people trying to do malicious things to these records, and it needs to be protected against those activities. So how does organizations know? The requirement of the HIPAA security rule is that all access to patient information needs to be recorded. That's why everyone needs to use a unique user ID and password, and any access to a patient record needs to be audited, it needs to be logged, and it needs to be reviewed. So organizations need to do periodic log reviews to see if there's some activity that shouldn't happen. Are there records being accessed at 4 a.m.? Is there an employee accessing 200 records while everyone else is accessing 20 a day? What are they doing? So really, if you don't look inside of these systems, not the EMR, the X-ray systems, and all of the other systems that have patient information, you may not know anything that's going on inside those systems. The other thing is you want to educate employees, let them know all access is being recorded. It may deter some inappropriate access. If they think that they're being watched, it may prevent an employee from doing something that they really shouldn't be doing. Okay, so the next largest breach is sending email, sending patient information that is not encrypted. So the bottom line, as we explained to clients, if you send a normal email without encryption, it's like sending a postcard. Anyone theoretically could snoop on it, read the contents, grab that contents, and use it. Encryption, it's like putting it in an envelope sealed. Only the person who it's addressed to can read that information. Email encryption now is relatively inexpensive. It's easy to implement, and more patients want to communicate with their providers via email. They don't want to call. They want to be able to communicate just like they would with any other services. Again, the omnibus rule makes business associates have to have a business associate agreement. So any of these organizations like Yahoo, AOL, Hotmail, which won't sign a business associate agreement, they should not be used by healthcare organizations, especially if there's going to be any patient information in there. It's a good way of moving those clients off of those free email platforms to Microsoft Office 365 or to Google Apps, or to implement their own Exchange servers or something like that. So very important to make sure that organizations are implementing email encryption. Another category of the largest breaches is all about hacking. A lot of organizations, when you think about protecting patient information, the first thing they think about is, oh, we need to protect it against outside hackers. Turns out that it's really insiders that you need to worry about, them losing laptops and snooping on records. Hacking, happens, but it's not, not as large of a category as some of the other ones. Although, when an organization gets hacked, it is, they grab a lot of information and it's very expensive. So one of the recent things that happened is Idaho University just received a $400,000 fine because they had a breach, and when they were audited, it turns out that their firewall was misconfigured. It basically let anyone into their network, and they never did any vulnerability or penetration testing. They didn't know they had a hole in their security, and when they were audited, they received a $400,000 fine. Second pretty interesting story is it didn't happen in the U.S. It happened in Australia, but an organization had their network breached, and the hackers, instead of stealing the information, they encrypted the information. They encrypted the database, and they basically left an electronic note saying, if you want this data back, you need to provide us with a $4,000 ransom. Very similar to some of the malware that's going around. So you can see if you have this patient information and someone can get in, they could hold that information for ransom, which could be hugely damaging to an organization. So what we recommend to our clients to protect against hackers is looking at passwords, complex passwords, periodic changes, enforcing changes, and account lockouts after a certain number of failed password attempts, implementing antivirus, anti-malware, and also educating employees on phishing scams to make sure that they don't fall for scams and reveal confidential logins that could access patient information. Then also, we highly recommend system patching and penetration and vulnerability scans, to make sure that those networks are secure. Okay, so the last category of the largest breaches was lost backup tapes. So, the backup tape is easily lost or stolen. It turns out that a lot of organizations give it to an employee to take home. They leave it in their car. They leave it in the car while they go into the supermarket. And if someone was to break into that car or that employee loses that tape, every record of every patient that you've had since you've been using your EHR is on that tape. So clearly you want to encrypt those devices. You want to encrypt those tapes, and the last one here, it's a great reason to move away from backup tapes. You don't want to have backup tapes. Using secure encrypted offsite backup, much better solution. Lower the risk to patient information and lower the chance of it being lost or stolen. And what we tell organizations as well is disaster recovery is not having a backup tape and then having to order a server. Right? So that could take 2-3 weeks before that server comes in. That's not a good disaster recovery plan. In fact, the HIPAA security rule says you need to have a disaster recovery plan. It needs to be documented, and it needs to be periodically tested. Well, it's pretty hard to periodically test ordering a new server from Dell. So we definitely encourage organizations to implement a much better and much more robust disaster recovery plan. So the last one, it wasn't part of the top 2012 breaches, but another big concern should be about social media. We're seeing more and more organizations having breaches due to Facebook, Twitter, where employees, doctors as well, are posting patient information on Twitter, Facebook. It turns out one California hospital, an employee, it was a temporary employee, they took a picture of a patient record, had something to do with sexually transmitted disease, posted it on their Facebook and made some rude comments. The name of the patient was on that chart, and the friends of this person said, this is a HIPAA violation. You can't post patient information. And the person responded, this is my Facebook. I can do anything I want, and there's only one name out of a million names. How do you know? Clearly had no understanding of HIPAA and protecting patient information. So more and more organizations need to educate their employees on the risk of social media to patient information. Okay, so with all that said, I just want to briefly talk about our service, our HIPAA Secure Now service. Basically, we help organizations comply with HIPAA, and we do that by performing their risk assessment. They work with us usually about 2.5 hours, let us know where patient information is, how they're currently protecting it, and then we go ahead and do the risk assessment. We document it. We have detailed reports that show them what they need to do to protect patient information. We make recommendations. We show them their risks. We also write policies and procedures, and we have videos that explain each of those policies and procedures. We provide online training and compliance testing for all of their employees, and then we deliver all of this via our web-based compliance portal. So we're able to help organizations across the country, and you know we've been, our pricing is very low, and we've been very helpful to over 125 organizations and growing every day. And the last thing I'll say about it is we have a partner program where we're working with a lot of GFI customers right now to you know help them sell HIPAA security services and help their clients or customers with HIPAA security services. So with that said, I will stop talking to myself, and Scott will open it up, and hopefully we'll have some questions and provide a little more, you know, insight and guidance. Thank you, everyone.
All right, thanks, Art. Yeah, actually, we've got quite a few questions here, so I'll get started. Let's see. Okay, Jack was wanting to know, actually had a couple questions. First of all, is there like a nationwide training organization and certification organization for HIPAA compliance?
Right. Okay. So there is no, you know, there is no certification that an organization will be, you are HIPAA compliant. Okay, so no organization can say we're HIPAA compliant. Yeah. What you can do is go through and do HIPAA compliance, okay, and make sure that you're doing the risk assessment, you're training your employees, and you're complying. But there's no certification. Now, there are training programs for individuals that you can become a HIPAA certified professional. There are organizations that will provide you with some of that certification. So HIPAA is kind of strange that way, where you know you can never get an organization that has a stamp of HIPAA compliance. They can say they're HIPAA compliant because they've done the things they need to do, but there's no official HIPAA compliance of an organization.
Okay, excellent. And on that subject, Tim was wanting to know what happens if a customer won't follow an MSP's recommendations for HIPAA compliance?
That's a great question. We get asked that all the time from MSPs going through our service. Your responsibility as an MSP is to make sure that you are complying with HIPAA, that you do the risk assessment, that you're protecting patient information, you train your employees, you have policies and procedures. It's not your responsibility to police your clients. You can make recommendations, you know, but you can't make them implement disaster recovery. But if they are bestowing, you know, their information to you, disclosing their information to you, you need to make sure you're protecting it. So the short answer is you can't, it's not your responsibility to enforce HIPAA to your clients. Make recommendations, but make sure that you yourself are compliant.
All righty, excellent. Derek here had a question about VoIP systems. He was wanting to know, do VoIP phone systems like Ring Central need to be HIPAA compliant, or do they fall under the conduit exception? Seems to be quite a few questions about this.
Okay, that's actually a really good question. So the conduit exception says if it's passing through, if patient information is passing through, so you think of it as like if you are using an internet-based system and you're basically using Verizon's, you know, data lines, that information is passing through. That's conduit. It's not really residing on their servers. It's a conduit passing through. They are not a business associate. But if it's residing, like I was talking about Dropbox or you know some of the email providers, if it's residing on their servers, they would be a business associate. Now with a voice over IP system, you know, using their pipes probably does fall in the conduit. But if there's patient information in voicemails and it is sitting on their systems in electronic format, then that is PHI, whether it's words, video, or voice. If it's sitting in a hosted mailbox, then that would be PHI on a business associate's servers. They would need to sign a business associate agreement. And the thing is, just to clarify, even if the data is encrypted, all right, and it can't be accessed by that business associate, that cloud provider, then it still is considered residing there, and it still makes that organization a business associate.
Okay, excellent. Let's see. Ann wanted to know, do you have any sample business associate agreements available?
We do.
Or any other material like that? Okay.
We do. You know, we could, if somebody wants to shoot me an email, I can be more than happy to share that with you. We also provide that as part of our service. You know, that's what we do. We help our clients not only, you know, with policy and procedures, but we do have sample business associate agreements. We have sample termination policies, et cetera. So a lot of the stuff that you need, we provide during you know, through our service.
Okay, while you're talking about your HIPAA Secure Now service, Art, do you conduct, Seth wanted to know if you conduct automated asset and vulnerability scanning as part of your service?
We don't. Basically, we don't have the automated component. We ask our clients to enter that information. A lot of times our recommendations would be that they should do penetration and vulnerability scanning. So we don't provide that as part of our service.
Okay, let's see. Okay, Jack's got kind of a he's got a kind of a lengthy one here. Let's see if you're ready for it, Art. You sitting down?
I'm sitting.
Okay. They have a dental client that has an application that stores the data for clients. So the application should be able to report on the usage. As the IT specialist, do they need to verify the internal usage by the staff, or can the owner of the clinic do it and report it back to the IT people?
Excellent question. So what I think what I'm hearing is it's a hosted cloud-based EMR service, and employees are accessing it. It would be that dental client's responsibility to check those audit logs, not the vendor who is hosting the EHR. The organization needs to check to make sure that you know, appropriate access is occurring. So if I understand the question correct, the answer would be the dental practice needs to do that auditing.
Okay, yeah, I think that's what Jack was asking there. I'm sure Jack, feel free to pipe up if that's not quite what answered your question. On that subject, Art, this is just I'm just kind of throwing this out there. What exactly is considered a patient record? For example, if you say that someone is a patient at a certain clinic, is that considered confidential information, or?
It is. So take the example that you only have two pieces of information. You know, the person's name and the clinic, but the clinic happens to be an HIV clinic. You know, just knowing that name and that clinic, you could put that together and say that that person has, you know, HIV. So you know, you want to make sure that if you're ever to have information, that you cannot associate that patient with, you know, anything that they, you know, is wrong with them, or diseases, or any medical information. So name is definitely part of protected health information.
All right, excellent. Christine had a question. This is kind of an overview question. She says, for example, we are an IT company. We manage the network of a doctor's office, but we do not use or disclose patient information. Are they considered a business associate? Right.
They definitely are a business associate. They're on the network that has servers that have patient information. They would definitely be a business associate. You know, they may. So some of those IT companies do backups off-site to their data center. But even if you come in contact with patient information while you're on the servers, while you're doing remote access and help desk services, that would definitely make you a business associate. IT companies, without a doubt, are business associates of covered entities. Now, with that said, you know, when you do a risk assessment, your risks are extremely low because you're not hosting any of that data. If it's not on your servers, it's not, you know, in your you know, your office. So basically, the risk that you want to look at is your touch points. You know, when will your employees, your techs, access patient information? Is that via, you know, remote access and help desk, you know, or when you're moving a server from one office to the next, or rebuilding it and copying data, you know, making sure that you have that data backed up? That is your touch point. So you know, so the answer is you definitely are a business associate if you're an IT company of a covered entity.
Alrighty. Seth had a question. This is more of a, I think, kind of a curiosity question. You used the example of Phoenix Cardiac earlier. How exactly did they get audited?
So that's a great question. So the way they got audited was a patient put a complaint in. All right, they said, hey, I logged on to this Google Calendar and I see, I see other patients. That means other people can see, my patient information. So they filed a complaint, and that complaint was looked at, and then an audit was kicked off, and that's how they got audited. So a lot of organizations are saying, well, how am I going to get audited? There's only these random audits, and there's a good chance I'm not going to get audited. Patient can file a complaint, turn you in, and that could trigger an audit. So in addition to that, I'll just give a couple more insight. I've mentioned meaningful use, and organizations are getting $44,000 per physician. Well, a requirement of meaningful use is to do a risk assessment every year. And now they are having meaningful use audits. So basically an organization could file for meaningful use, and they could be audited and say, where is your risk assessment? Show us proof that you're doing this. And there's other things that they need to show for meaningful use, but one of the things would be if they didn't do a risk assessment, they can get audited from meaningful use risk assessments. There's a permanent audit program that's going into effect, very similar to the IRS and auditing tax returns, and patients can turn you in or file a complaint. So 3 ways that an organization can be audited and asked to show HIPAA compliance.
Okay, Jack, I think he was referring back to one of your earlier slides, one of your slides at the beginning. He's wanting to know, at one point you said that servers need to be in locked cabinets. How did you find, where exactly could an MSP look to find out some regulations and rules like that?
So the interesting part about HIPAA, and it's everything is not black and white. It basically says that you need to provide reasonable safeguards and to implement HIPAA security. So it's written for organizations that have one employee, one doctor, all the way up to huge healthcare organizations with hundreds of thousands of employees. So it says that you need to implement reasonable safeguards, and one of those reasonable safeguards that you need to implement is physical security, around physically protecting servers or systems that contain patient information. It doesn't specifically say you need to have it in a locked cabinet. It could say, well, we have it in a locked office. But you need to provide physical security around that. All right. So and the more security you provide, the better and the safer that patient information is. So it doesn't specifically say it's got to be in a locked cabinet, but it needs to be protected. It also needs to who's ever touching that server, a log needs to happen, be recorded. So there's a lot of physical guidelines around HIPAA security.
Okay, excellent.
And that comes down to risk. And just one last thing, that comes down to the risk assessment as well. So when we do the risk assessment, we ask those questions. How are you physically protecting these? If it's sitting in the middle of the floor where patients could potentially get to it, or it's under an employee's desk and it's that there's 10 different employees around it, that is not providing the reasonable physical safeguards. Now, on the other hand, it may not be reasonable to build a data center, like a very large company, but you need to protect that, pull that out of the main floor, put it into a locked office, so there is some physical security around that. Obviously, putting it in a locked cabinet would be the best.
All right, thank you. We got a question here from Bjorn. He has a doctor's office saying that they do not need to be HIPAA compliant, as they do not take Medicare or Medicaid patients. Is that true?
So if they don't take Medicare or Medicaid, but they take private insurance, Aetna, Blue Cross, Blue Shield, Cigna, that would make them a covered entity. If they are strictly a cash business that doesn't take any insurance at all, then that would not make them a HIPAA covered entity. So basically, the quick back of the envelope way of figuring out if an organization needs to comply with HIPAA is, do they take insurance, both Medicare, Medicaid, and private insurance as well. If they don't, then they do not have to comply with HIPAA. Doesn't mean they shouldn't protect patient information, but they don't have to comply with HIPAA.
All right, that's good to know. Okay, Ryland, we got time for just a couple more here. I want to thank everyone for all those. Let's see. Ryland had a question here. Okay. We host email. If a customer policy is to not send patient info via email and a customer employee does so, can we, the email hoster, be held liable?
Now, I would say that you as the email hoster, won't be held liable as long as, again, you're making sure that you were putting reasonable safeguards in place to protect that data. It would be the organization that has to put the policies. And again, reasonable, and there's another thing in HIPAA which is called addressable, and email encryption is addressable. So to protect patient information, it should look at encryption. But it doesn't say that the organization has to implement email encryption. What it says is you need reasonable safeguards. So a reasonable safeguard may be that we'll make a policy that says we will not send PHI via email. And we'll let our employees know, we'll train them, we'll have written policies, we'll have a workstation use policy that lets them know, they'll sign it, and that's the way the organization could get around implementing email encryption. So the long and short answer is, as an email hoster, that would not be your HIPAA violation.
Okay, we'll go back to Jack. Thank you for the questions, Jack. Jack's asking quite a few questions here.
Thanks, Jack.
Excuse me. Jack, to go back to that dentist office, he also says they have physical files out on open shelves. Does that pass HIPAA guidelines?
So physical files, I guess these are paper-based files. If those files should be locked in cabinets. Now, if they are away from patients and patients can't get to it, open files behind the desk, that would probably be okay, depending on the risk. So if you do in the risk assessment, if you find that is accessible, to patients, then that clearly would not be okay. But if it's not locked, but it's someplace where patients couldn't get to it, that may be okay. It depends on. I would definitely look at that in a risk assessment.
Okay. Okay, we'll end with one here from Kevin. It's kind of a cloud-based one. He's wanting to know if Office 365 primary, the hosted email exchange, is HIPAA compliant.
It is, and Microsoft will sign a business associate agreement with the organization. So Exchange Online is definitely HIPAA compliant. Now, all of that information is encrypted, and it is compliant. If an organization then sends patient information via Office 365 to a patient or to some other organization, it doesn't have email encryption built into it. So, you would still need to implement email encryption if you're sending patient information outside of Microsoft Office 365. So if it's sent between, other employees all on the Office 365 platform, that's all encrypted and secure. Any information that goes out to other recipients would need to be encrypted, or, like I said, some policies that prevent sending PHI in email would have to be implemented.
All right, excellent. Well, thank you very much, everyone, for the questions. Thank you for being here, Art. I'll go ahead and let you, how do people get in touch with you if they want to pursue more, they want to find out more about HIPAA compliance? How does someone reach you?
Sure. So, I have my contact information. Feel free to shoot me an email. On HIPAASecureNow.com, we have a partner tab that you could fill out. If you're interested in becoming a partner of HIPAA Secure Now, you can request the information. We'll be more than happy to contact you and tell you about our program. Or if you're interested from your own organization, there's a contact and all of the information about pricing and details of the service is all on HIPAASecureNow.com.
Okay, excellent. Thank you, everyone. And yes, you'll get a link to the recorded webinar either tomorrow or Monday, hopefully tomorrow. I'll try to get to it today. It'll be in HD, so it's going to be a nice looking video. You'll get a link to that where you can watch it. You'll get an MP3 where you can download it. And then if you look for iTunes, that'll be on iTunes probably next week, the podcast. You'll get a link to all that stuff from the GoToMeeting software. So keep checking your email box for that. I want to thank Art, I guess Art from HIPAA Secure Now. Thank you, Art.
Thank you, Scott, and thank you, everyone. I appreciate your time and giving me the opportunity to talk about HIPAA security. Thank you.
All right, excellent. Thanks, everyone. Again, I sent around some links. Sign up for our next webinar, and thanks for coming out again, and we really appreciate your time. All right, goodbye, everyone.
Take care.